Member Saanich North and the Islands.
Thank you, Mr. Speaker. At some point, I guess we'll get back to addressing global warming. As I've shared with the Minister, I've been receiving a constant flow of advocacy from my constituents about the very real cost of the crisis in primary care delivery is having on their health and well-being. There are between 10 to 14,000 people currently unattached to a primary care provider on the Saanich Peninsula. In other words, about 30% of my constituents on the peninsula don't have a family doctor. While the doctor shortage is a crisis in my riding, there's another problem lurking just under the surface. We know that 40% of the physicians in BC are over the age of 55, with the average age of retirement being 65. So this has the potential to get much worse. A Czech news story last week highlighted that the Yates Integrated Health Clinic that services almost all of downtown is expected to close this summer. Thousands more without a family doctor. In the end, government policy incentivizes doctors away from family practice. My question is to the Minister of Health. We need to change the incentives to make becoming a family doctor more appealing. What is the Minister doing to address this challenge?
Minister of Health.
Thank you to the member for his question. The member will know that when I became Minister of Health, about 18% of British Columbians were without a family practice doctor or nurse practitioner. The member is correct that many doctors are also preparing to retire, and we have in British Columbia, we're 12th of 13 Canadian jurisdictions in the use of nurse practitioners. So what have we done? We've established, working with divisions of family practice across British Columbia, the Premier and I announced a primary care plan that I think starts to address this situation. We're establishing primary care networks around British Columbia, which, working with divisions of family practice, will establish team-based care across the province and improve services for people who are in our mind's eye. We're establishing urgent primary care centers, 7 so far, with more to come, Honourable Speaker. We're establishing and supporting new community health centers, including many in the member's constituency who we're supporting right now with direct supports. To support all of those initiatives, we'll be hiring 200 new family practice doctors, 200 new nurse practitioners, and 50 new clinical pharmacists to support these networks. And in direct response to the exact question the member raises, Honourable Speaker, they will be paid by alternate payment methods. 85% of resident doctors in a recent survey in BC from UBC said they wanted to see alternate payment methods in primary care, and in direct response to that, all 200 positions will have alternate pay methods, which we hope will support family practice medicine in the future.
Saanich North and the Islands on a supplemental.
Thank you, Mr. Speaker. And I'd like to thank the Minister for taking the time with me last week to discuss the issue on the Saanich Peninsula and to canvass as many issues as you can on the healthcare in a very short period of time. And I'm glad that the Minister raises the issue around the 200 salaried doctors and nurse practitioners. I think how family practice doctors are remunerated, in fact, how many of the members that work in many healthcare practitioners, how they're remunerated is an important part of solving this issue. Last week, I asked about an issue in the social care sector where you have 2 different payment standards for people doing essentially the same work. And so to the point of the alternative payment program, I'd just like to get the Minister's response to whether or not he feels that the APP system and working alongside doctors getting paid under that model, working alongside doctors that are in fee-for-service, if that is also creating the same effect as about the question that I asked last week, and if he's going to include family practitioners already practicing under the AAP model.
Minister of Health.
Well, thank you, Honourable Speaker, and I think there's some good news, although I think these are significant challenges, and I think many British Columbians who are in need of family practice doctors, many British Columbians, many women who are seeking support in pre- and postnatal care, many frail seniors, many people addressing mental health and addictions understand the real vulnerability of not having a family practice doctor or nurse practitioner. There is some good news in terms of the 200 family practice doctors and 200 nurse practitioners. We've had 727 expressions of interest so far. We're established and signed with local divisions of family practice. In other words, Honourable Speaker, local divisions of family doctors, Honourable Speaker, 18 primary care networks already, 7 new urgent primary care centres, 3 new community health centres, Honourable Speaker, and we're working hard in the members' constituency to establish one there. The thing we have to do in cooperation, I think, with divisions of family practice, with communities, with nurse practitioners, with other health professionals, with skilled health workers, is work together to solve this problem. We're doing that step by step, community by community. I'm very optimistic and proud of the progress made so far, but we've got a lot more work to do.